Hello, if you're watching this informational video, you or someone you love may have been recently diagnosed with pulmonary hypertension. The aim of this video is to introduce some of the causes, effects, and treatments of this disease. Before we begin, it is important to explain that pulmonary refers to the lungs, and hypertension refers to an elevated blood pressure. Therefore, pulmonary hypertension is a disease of the lungs' blood vessels caused by high blood pressure within the lung circulatory system.
We will start with a quick overview of the circulation of blood through the body. The circulatory system is comprised of two separate loops that connect at the heart. We can simplify the heart as a four-chambered box separated into two distinct sides, shown here. In what is called the systemic circulation, blood is pumped by the left side of the heart, where normal blood pressure is the highest, to the body tissues and organs. Blood then returns via the veins to the right side of the heart, in which pressures are significantly lower. The right side of the heart is the beginning of the pulmonary circuit and serves as its pump. Blood in the pulmonary circuit travels through the right atrium, the right ventricle, and then the lungs, where oxygen-depleted blood replenishes its oxygen supply during breathing. From the lungs, freshly oxygenated blood returns to the left side of the heart, where the cycle begins again in the systemic circulation. Damage to the vessels is caused by increased blood pressure and can result in the thickening of the vessel walls. The thicker-walled vessels are less flexible and can further increase the pulmonary blood pressure, creating a cycle of damage.
The pulmonary circuit is designed to maximize oxygenation of the blood and prevent damage to the delicate air sacs, or alveoli, and the blood vessels, where gas exchange occurs. This is accomplished by maintaining low pressures in the pulmonary circuit. The high blood pressure within the lungs increases the workload of the right side of the heart, forcing it to work harder. This can cause a thickening of the muscular walls of the heart, diminishing its ability to efficiently pump blood. Though the body has ways it can compensate for pulmonary hypertension, the cardiac damage that results can lead to heart failure, which can take the form of decreased function or heart attacks.
Pulmonary hypertension may cause damage to the lungs themselves. Increased blood pressure can push fluid out of the vessels and into the lungs, which will limit the ability of oxygen to enter the blood. Oxygen is forced to pass through this extra layer of fluid, which decreases the amount that can enter the blood.
Fluid accumulation within the lungs can cause symptoms which may affect one's ability to function in their daily life. Symptoms can include shortness of breath or difficulty breathing, a productive or wet cough, fatigue, difficulty breathing while lying down.
If untreated, pulmonary hypertension can cause damage to the blood vessels or lungs, significant fluid accumulation within the lungs, and heart injury. The effects of this disease can be serious and may ultimately require hospitalization or even surgery and may be life-threatening.
You may be asking yourself, pulmonary hypertension sounds scary and terrible. What can be done to treat it? Currently, there is no cure for pulmonary hypertension, only ways to manage the symptoms and underlying causes. If the disease is diagnosed early, the conditions and damage may be limitable or possibly reversible. Unfortunately, early diagnosis is difficult as there are few visible symptoms in the early stages of pulmonary hypertension.
The primary goal of current treatment options is to delay disease progression and lessen the symptoms. Lifestyle changes, such as a low-sodium diet and monitoring of fluid intake, can lower blood volume, indirectly reducing pressure. Activity changes, such as low exertion exercise and weight loss, can directly decrease one's blood pressure.
Multiple medications are used in the treatment of pulmonary hypertension. Antihypertension medications and vasodilators are commonly prescribed to lower blood pressure by directly relaxing the blood vessels. Diuretics are also prescribed to decrease water retention, which reduces fluid accumulation and overall blood pressure. Anticoagulation therapies are often indicated to limit the possibility of dangerous blood clots forming in the lung blood vessels.
At present, treatments are generally used in combination and are personalized to each individual. In order to limit or slow the progression of this disease, compliance with treatment recommendations is critical to improving prognosis and quality of life for the patient. Failure to follow treatment regimens can lead to worsening of the disease, further damage, and a generally poorer outcome.
We hope that this informational video has answered some of the questions that you or your loved ones may have had about this diagnosis.